Here in NMC, we are a team of 8 histopathologists, which includes specialists as well as consultants, along with a team of 13 histotechnologists, including a histo supervisor. In our labs, work is almost equally divided among all the histopathologists. Complex cases will be dealt by the consultants, and we do have an intra-departmental consultation with each other, especially for cancer cases. And we have a service for all 7 days on rotation. Here in NMC, we receive histopathology specimens as well as cytopathology specimens. The histopathology specimens mainly include small, medium to large tissue biopsies, including resections. We have a good load of oncopathology specimens of different branches like urology, gastrointestinal surgery, and neurosurgery as well. We also include frozen section services, that is intraoperative diagnosis, for which we need to give a rapid reporting within 20 to 30 minutes. We also have immunohistochemistry services, which helps us to give a accurate diagnosis. UltraGROSS, it's a wonderful and an amazing gross station with the many advantages. The main thing is that this gross station has 2 stations wherein 2 people can gross at a single time, and this saves time of the pathologist.
It's amazing when we have now 2 stations for the grossing. Before we starting the grossing until the pathologist finish, then after that the technologists they start their grossing. Now at the same time they can sit and do the grossing.
One more advantage is regarding the formalin fumes. We just don't feel any formalin smell in this new milestone UltraGROSS station, and this is very, very important as both pathologists as well as technologists are on a daily basis exposed to formalins. And one more thing is the camera. There are 2 cameras attached, which helps us to record each and every aspect of the grossing, starting from the tissue measurement, the dimensions. So taking a photograph and storing it in these systems helps us to just have a look at the gross specimens right in our office rather than going back to the gross station.
With the innovation of the UltraGROSS MacroPATH, we're able to take pictures of the cassette, and which will show how many pieces the sample has, or the name of the cassette also. When we research back on a cassette, if a piece was lost, we know exactly what was done in the grossing part. It's really good for audit purposes and general traceability.
We are using milestones machines, which are like really precise and accurate in the quality and the whatever tissue and specimens used. This gives technologists and pathologists as well a good workflow, and they can like monitor each cassette and how many bits in the cassette. It gives everything by details for the unique patient. After finishing preparing the sample in the cassette, we have to use C-tracker to check how many cassettes we did, and as well as if any duplicate, it will be appear in this stage.
The T-tracker is really good. The benefits that it has is it uses a dual sensor. It creates a picture on the screen, like a virtual image, which tracks all your cassettes and shows where the cassettes are located.
We'll check all the cassettes inside the magazines, how many blocks. They will check also the patient identification. If we have any mismatching, or if we have missed any block, just immediately to catch. This new technology now we use it.
We have MAGNUS automated processing machine, which contain 2 cavities, main cavity for the cassettes and the other for the wax. That gives a big advantage, so the wax it will not be like mixed with the other reagents, so that the wax it will be clean for the long time, and will decrease the reagent consumable.
MAGNUS, it's amazing, like a Ferrari in the lab.
There's many things I'm impressed about with this processor, but the main thing for me is the xylene substitute, and it doesn't use the xylene. The way we change the reagents, it's very safe rather than just pouring in and then having to inhale the fumes. Also, the embedding, the fact that we use Synergy and it's auto embedding, I think this is great and it's wonderful.
All the milestones have the unique tracking system. It will track all the specimens, starting from the grossing to the processing until it reaches the embedding area and the microtomy area as well, including the patient ID. It's important to be accurate regarding the patient's specimens and how many bits does they have, in order to avoid any mixture, to avoid any mistakes, because patient sample are critical and it needs to be maintained properly. This is one of the great features that I was missed in the previous years in my experience, and now I'm enjoying doing this also.
The main benefit of having this is if a cassette was lost or we can't find the sample and something was missed, you can then use the Milestone MileWATCH system to type in the lab number, and it will locate the cassette for you, or which processor it went on and which run it was, whether it was processed or not.
But in future, as a part of innovation, I hope that we have molecular pathology as well as genomics in our laboratory, which will make our lab a complete, excellent lab and a core referral lab for all the clusters of NMC.